This is from the Daily Mail. I've been meaning to get to this article. Former NHS, that's former National Health Service in Britain, the former National Health Service director dies after operation is canceled 4 times at her own hospital. A former NHS director died after waiting for 9 months for an operation at her own hospital. Margaret Hushen, a former mayor, had been waiting since last June for a follow-up stomach operation at Broomfield Hospital in Chelmsford, Essex. But her appointments to go under the knife were canceled 4 times, and she barely regained consciousness after finally having surgery. Her devastated husband, Jim, is now demanding answers from Mid-Essex Hospital Services NHS Trust, the organization where his wife had served as a non-executive member of the board of directors. He said, "I don't really know why she died." Well, I'll help you out. Because having coverage does not mean you get quality, timely medical care. Everybody in North Korea is covered under their health care system. They get no medical care. It has nothing to do with quality. He said, "I did not get a reason from the hospital. We all want to know for closure. She got weaker and weaker. She waited and operations were put off." Mr. Hushen said his wife, 72, had initially undergone major stomach surgery last June, but the follow-up procedures were repeatedly abandoned. The former mayor remained at the hospital for months, but her family feared she was becoming institutionalized and decided to bring her home until an operation was a certainty. Look at the inefficiencies, the stupid decisions. From July to October, there was talk of another operation. Then between November and December, then there were 3 or 4 postponements, and she was becoming so institutionalized, we decided to get her home until an operation was certain. It was a blessing because although neither of them could have guessed it, it should say, it gave us a last month together. Here they are. Gave us a last month together, however. It's likely the woman didn't need to die. She was the mayor of the damn town. She served on the board at one point. She needed follow-up surgery. And they canceled it and canceled it and canceled it and canceled it. That's what happens when you have shortages of doctors, shortages of facilities, and an overwhelming demand for services. Oh, it's free. Nevertheless, she was unable to take proper nourishment and went into the operation on the better side of a low state. She was very weak. Mrs. Hushen was well known and respected after serving in local government for the past 30 years, and she became mayor of Chelmsford in 2006. Mike McRory, a fellow Liberal Democrat and on the council, said we were all stunned to hear she had died after the operation and so forth. See, here's the thing. They're never going to get rid of the National Health Service because that's how statism works. Thousands of people die there every year. It could be tens of thousands. We used to go through the stats when we were debating Obamacare because of lack of care, inferior care, the wrong kind of care, and on and on. Because the doctors are overwhelmed and they become bureaucrats. Same with the nurses. Same with everybody else connected to this. It's an amazing thing. Capitalism works when it comes to producing and choosing toasters. But when it comes to the big things, it's abandoned. And yet it's the big things that will do best. It'll drive down prices. And through competition, it will improve services. And on and on and on. And more will be available to the average person with an average income. But it's being abandoned. It's being abandoned in our own country. That is probably a very frequent occurrence. But there's a woman who really had some power, was in the know, and she couldn't get the help, which is my point.